Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot with facial balancing as well. I'm going to showcase this patient's result. This is a patient who I've been working on for a little bit of time now, more than a year, and a really, really nice gentleman, really, really nice. And he had done so many different treatments before and found that he was getting a little bit of improvement, but really wanted to push it over the edge. So really, really happy with this patient because he had a few things that were making it a little bit more complex. You can see, even though he is lighter skin type, he's a Fitzpatrick 2 actually, but he did have a lot of pigmentation issues after he had underwent a very aggressive laser session. Actually, he did a couple times actually with somebody, and they went a little bit too aggressive around the eye area, and just in the cheek area as well. There was a lot more redness, and he was just finding that like just his skin tone was just really, really poor and wasn't as even. And then that also complicated things because we didn't want to really bulk heat the skin. We didn't want to overly heat the skin. We really had to manage his scars with really a lot of precision. We did that with a few different steps. We did that mostly with Subcision. We did it with TCA Cross. We also did some volume replacement. In this case, actually, he opted for fat transfer, which worked out really well for him. And this is basically we saw him in May, and then we ended up seeing him now in October. And you can see that that significant improvement over here. And actually, I just saw him maybe about a month ago or so, and he still looks really awesome. Hey, Joey, good seeing you on. Thanks for coming on too. I appreciate you. So yeah, this is a really, really nice case because it's really a story of somebody who's went to multiple different people. He's tried a lot of different things. One of the things that he was saying was that he didn't really feel like he was not just really getting the results that he didn't want, but he just found that the providers he was going to weren't really taking care of him properly. The office staff wasn't really helping him and with appointments, things like that. So we were able to get really, really excellent results for him, but it definitely was a journey for this patient to really get to this. But it definitely was a journey for this patient to really get to this point without irritating his skin too much, without making it so that he was too sensitive. And part of it was just because he did get a little bit of damage actually from a really, really aggressive treatments beforehand. If we are sensitive to the skin, is it likely that RLT will cause pigmentation, or is it still worth a try? What are you referring to when you say RLT? Okay, saying, hey doc, can you do Subcision Bellafill on atrophic scars on the nose, or is it a no-go zone? No, we can do it there. Actually, you could do Bellafill on the nose. We just have to be really careful when we do it, of course, and there's only certain times that we would do it there. But we absolutely can do it there if it's appropriate. I did it, I think it was 2 days ago, and worked out really, really well for that patient. She had a big boxcar scar over here. I did it like last week also. There was a patient that she had it over right here on the bridge of the nose. It worked out really well for that as well. So it's sort of depends on, the scar type and if it's going to really respond with volume. Not all scars do. Can you please talk about TCA Cross? I did the Quattro by Dr. Roulan almost 2 years ago. Yeah, so my preferred way of doing things is really with the TCA Cross method. I like it because I could just change the concentration of the acid depending on the depth of the scar. So that's what I do all the time. And really, there's a way to really make sure that we could do it safely. I found a lot of times, with a lot of people that were doing the Phenol Cross, they weren't really doing it on a lot of different scars. Actually, I had a patient who had done the, something like this, the Trio, Quattro, whatever it was, and it was really just a few spots that they did, and there were so many boxcar scars. But really, it's because it's, what ends up happening sometimes is that you can't use that concentration, that high concentration of the phenol acid on every single individual scar. I mean, that's possibly what it is. I doubt that it's really just strictly like due to laziness, but you got to be very, very precise when you do this stuff too. It takes a very high concentration to do this, do it every single day. I did multiple today. Really, a lot of people. Today was interesting. It was like a lot of people with rolling scars, boxcar scars. This whole week was like boxcar scars and ice pick scars. So I did a lot of TCA Cross actually. Lucky Singh is saying congrats for being out of the social media jail. Appreciate you. Thank you. And just got here. Does Accutane help with acne scars? Yeah, it helps somewhat with it. It's going to actually trigger a bit of collagen response because it'll reduce some of that oil production, helping the acne, the cystic lesions get calm. That also is going to really, really be important because think of it this way. Really, it's really relatively straightforward when you think of it this way. That when you have a lot of oil, there's a lot of inflammation just from that. And reducing that oil can help your body produce a little bit of collagen. But more importantly, it also could shrink the diameter of scars, which is really like something you can see visibly. And then also, if you have bacterial lesions on the surface of the skin, like these acne lesions, these cystic lesions, your body wants to combat those little cystic lesions instead of actually solving the collagen response, the scars that you're trying to work on. So you definitely want to do, a few different steps before you do Accutane if it's more mild to moderate. But moderate to severe acne, really strongly consider doing something to manage it really strongly. And that may end up being something like Accutane or the Cure laser. Either option is totally okay. When do you use RF microneedling over laser? So it's mostly when we're trying to tighten skin, and that's all we're trying to do. For myself, I would say, I don't really do it too much for skin texture or for just like overall for scars, like really almost ever, unless I'm doing with Subcision and we're trying to tighten skin in some areas. Otherwise, though, it's not really my go-to for the vast majority of patients. It's very good for tightening, especially around the neck area, though. It's nice because minimally invasive. It does work really, really well for that. And then like the lower part of the face works really well for that. But there's no question that people could use too much heat, too much energy with these radiofrequency microneedling devices. And I think you could really run into problems with volume loss then. Vinod is saying, I've been reading about both Sculptra and Bellafill, and I'm wondering what situations make you lean towards Sculptra instead of Bellafill when it comes to treating acne scars? Well, a few things. Hi, Mrs. Jones, by the way. Thank you so much. A few things basically about this question where we decide Bellafill versus Sculptra. Sculptra, if there's a lot of fat loss, a lot of volume loss, really does help it because we really want to get some more volume in there. We can use Sculptra because you get a more robust volumization effect. It's not going to last as long as Bellafill, but it does really give you a lot more of that volume. Bellafill is a lot more discreet. It's really, really soft, really good for certain spots where it's like just indented in certain areas. You want to support those particular scars. Not as great for like these. I mean, I shouldn't say it's not as great. It's still great, but it's just going to take a lot longer to do, a lot longer to solve when you have very, very deep, thick scars. It's going to take several rounds because even if we put that Bellafill in there, we don't want to put an enormous amount in there because you could end up actually really running into a problem where it doesn't look as natural because it is a more permanent filler. It's going to stimulate your own body's natural collagen. We just have to go really slow with it, a lot slower than people expect. So I don't usually do it with patients where I try to solve like the complete volume loss that single session. And unless there's like very mild atrophy, mild fat loss, that's a different story. But vast majority of people need several rounds of Bellafill. It is permanent, or semi-permanent. Most people would say that it is permanent because it just doesn't get absorbed fully. But at least we want to be so that means that we have to be really slow with it, really, really careful with it. We don't want to just put a bunch of it in one spot. You're going to let your own body naturally create some collagen around it. Okay, saying thoughts on Phenol Cross over TCA Cross. Does it have less chance of scars widening? I'm East Asian. That's what I was just really talking about earlier, where the reality is that I have not witnessed this issue with TCA Cross. There's a way of really just being very precise. You don't have to use too much, the way the concentration that people use, you don't have to use that high of concentration for your acid. And people just tend to, like, you will hear people that just use only 90, 100% of TCA, and that's when they run into so many problems with this stuff. If we are sensitive to the sun, is it likely that red light therapy will cause hyperpigmentation? Yes, the short answer is yes. It's possible. That's why I don't recommend it really typically for my patients when we do lasers, especially because they're mostly Fitzpatrick 4 and above. I'd really be worried about pigmentation issues if they're using red light therapy. I know there's some benefits to it, but I am worried about that pigmentation issue afterwards. Hey, Gabe, how's it going? I didn't realize you were on here. Gabe is asking about, Gabe is saying Bellafill works, but you need a lot of sessions and it is expensive. It is expensive. Yeah, there's no question. I mean, I needed a lot of Bellafill on my own face. It just requires a lot, really. There's just no other way. But the reality is that so much of scars is essentially not just a collagen destruction, it's also a fat destruction issue. And you have to do something for that volume loss. You got to do something for it. And whether that is Bellafill, whether that's Sculptra, whether that's Radius, it doesn't matter. You could do hyaluronic acid filler. We could go through the pluses and minuses for each of those things, but it's ultimately going to be like the thing that's going to push your results over the edge. It's just a lot of times. It takes a lot longer. It's a lot slower than people may expect. Thoughts on combination of Morpheus8 and CO2 laser. So Morpheus8, you could go deeper. You could try to trigger a little bit more of the skin tightening process for it. But I don't know if I would really love it for scars. If that's what you're referring to. If it's more for like anti-aging purposes, maybe. CO2 laser, very, very different. With CO2 laser, it's going to be really excellent for skin texture issues, especially if you're doing it correctly in the right skin type. So not sure exactly what your condition you have. If you're doing it for scars, probably not going to help too much. But yes, it could definitely help for skin texture. Smiley saying, I was watching your video from 2023 and it looks so different, amazing in both. Can I ask what changed? Well, thank you so much, by the way. Appreciate you. I did more lasers, which helped out. I did a little bit more of I don't know. I guess I did a little bit more Bellafill in certain spots. Like I did it like a lateral cheeks a bit, a little bit, and like along the edges of like my jaw, a little bit in the chin too. So that all helped out really well. Just really probably just like working out a lot more too now. So just got like a little bit more chiseled out from that. I used to do a lot of like working out, and then I was like really, really busy with the office. I'm still super busy with the office, but I was just like, you know what? I'm just always going to have take a little bit more time just for me to work out a lot more. So it's like, that's been, I think, just been helping me out a ton. So yeah, I think those that actually, I think they appreciate it. A lot of people are noticing that it's like, I am looking like that now. I look a little bit more like healthy too, which is nice for me because it's like, I'm working all day and like it's, I didn't really have to change too much, other than I did cut like all sugar. When I turned 42 last year, I cut all sugar actually. Well, I shouldn't say all sugar. I still have a little bit of sugar here and there, but I used to eat a lot more sugar. Like it was like my go-to snack in between like patients when I was like a med student and in a residency. I still had that habit a bit like as I got older even. So like I just cut that out, which helped a ton. So there's like a few tips. I'm not, I for some reason on the Instagram or on these algorithms, there's always looks maxing stuff and everything like that. And it's like, some of it's just like so much more simple than that. Like they're doing like all these exercises and things, but like so much of it is just with the diet and the exercise and like just starting with the basics. And then you just do like really well. Of course, I'm a big fan of collagen fillers and collagen stimulation too. Is bone broth actually good for skin? That's a good question. I do think that there's probably, I know people were asking about it before, and I was thinking about it some more. It was actually a really, really good point because bone broth does have more collagen. And, I was thinking, like, why is it that my South Korean patients respond so well and so fast? And other patients too, but of East Asian origin, if they have like more collagen type foods, and especially if their food is not particularly oily or so too, potentially there's like a whole diet component with what we're eating with collagen. I'm not so sure about the collagen supplements. I still think that we should probably really focus more on our diet for this stuff. But if you look at it, it's like some cultures just really have healthier food, and it's possible that that's why they just get a faster, more robust result. My patient, actually, I don't know if you're on right now, but I was just talking about you earlier. I don't know if you're on right now. Teaching, are you on here? But if you are, I was like, your scars are almost invisible right now, and they're like 3 months out, and it's amazing. I'm not sure if you're here. It's possible. She has a new baby, so it's maybe not. But like, pretty amazing though. Actually, though, that like it was an amazing collagen response 3 months out. It's actually a big difference from like 1 month out. and now like 3.5 months, I guess also. So she did, we did TCA Cross, erbium laser, and then through the laser channel holes, I put a dilute form of Sculptra for her. And she's of Taiwanese origin, so it'll be interesting if she does come on. And I'm not sure if she is going to let me share photos at some point, but she does come on. She does say that she does treatment. So, yeah, you know, that's why I'm bringing her up right now. But yeah, so she actually, like, it is almost invisible on the lateral cheeks, like almost invisible. And like she was like almost in tears today, just like explaining like how happy she was. We're going to just do a little bit left with some more TCA and laser. But it's really cool. And, you know, she does say that she's just like eating really clean, doing really well with everything else. There's, I think, a big component with that. So to go back to your question about bone broth, is it going to be something that's going to be effective? I don't know if it's necessarily that you have to do bone broth per se, because, you know, it could just be other aspects for like things that are rich of collagen, like food that is rich in collagen. And I was kind of like, and I've always been saying, well, I'm not so sure about collagen supplements per se. But I, you know, as we talk on these things and things like that, I'm really open to like changing and adapting to like whatever I find also. And I'm looking at it, and it really is that like I was constantly thinking to myself, what are the reasons why certain patients really do get a really fast or more robust result? And you do the same thing on someone else, and it's like, you know, it may take longer, or you may have to do more steps to get to that same result. Like this patient I'm just referring to, you know, she's somebody who struggled from scars for years and years and years and years, and had done so many different things. And so she said right now today, she was just like, you know, I felt totally hopeless until we did these treatments, and it's just like, you know, it changed her life. And I was talking about that earlier, where it's interesting in this kind of world that I'm in, that really it's like this process where we actually can like shift someone's timeline in a way that really they're going down a direction where it potentially is like they're viewing things where people are bullying them, or they view microaggressions constantly. You know, people with severe scars will report that. You know, they'll tell me that, you know, it was really difficult because like growing up, I would feel like that people were just like judging me because of my scars, and it's weighing on them constantly. They'll imagine all the other things that are happening in your life, all the other stressors like job or whatever else is happening, or like the Cheeto man doing something random. And it's like, you know, you have all these things happening, and then like you on top of it are looking at yourself, and you're not looking at the best possible version of yourself. And then somebody really potentially judges you for that too. So now all those things are just kind of like adding onto it, and it just like adds like and adds and adds. And now everything kind of skyrockets. All the stressors just sort of skyrocket for patients. And so it's like we could, if we like, let's say for this patient, for example, and at some point she'll come back on because she usually does come on night, but like, yeah, we solved it. I mean, pretty close to solving like her lateral scars. And she told me herself, she's just like, you know, this just changed my life. This just changed the pathway of my life. And it's really, really interesting terms, because that's how another patient was talking about it too. Like really, it just changed the direction that they were going in, because it really was otherwise like this way of like being really, you know, not necessarily self-defeating per se, but really feeling really terrible about a lot of different things. And, you know, my two of my patients just the last couple of days were talking to me about like just how upset they were about the choices they made, about like how they caused these scars because they picked at it or whatever else happened. Or, you know, another patient was just saying, actually a few patients this week were saying that like their parents didn't take care of their scars really, you know, or their acne, I should say. They didn't take it seriously enough, and then they ended up getting really severe cystic acne with severe scarring afterwards, and they're kind of upset with their parents, you know, and it's like something that they haven't been able to forgive their parents for. And it's like part of this journey is like actually just doing that. Like you're going to be like, you go through this process and you'll realize that you were like 16 years old, 14 years old. Some people were 10 years old. It's like, you know, you went through that whole like process as a kid as like a really serious trauma. It's like you made some choices, like, okay, you picked at something, but I can tell you there's a lot of people that pick things and they don't get bad scars. A lot of it's genetic. A lot of it's just like ready for, you know, a lot of things just can happen in people's lives. And some people just don't even touch their skin and they still get scars. And like my patient, one of my patients today, he was reporting like huge, like cystic lesions, huge volume loss afterwards. And, you know, it's sad really, because like, some people like that will view it like sometimes it's their fault or their parents' fault. And you like part of this actually of doing some of these things sometimes is just sort of like forgiving yourself that you were 14 years old, 16 years old. or whatever age, really, honestly. Sometimes things happen. It's like things can happen with things that like sometimes freak accidents still happen. And it's like part of what we have to do is just really start working on like forgiving ourselves first, really. And then like thinking about it, like what was the rationale for my parents not doing it? Maybe it was just like economics. One of the real things that people don't recognize, one of the biggest things that people don't recognize is that a lot of scarring is due to socioeconomic factors. A lot of it is. You will hardly see people of higher socioeconomic status having severe acne scars. I'm not saying that there's no chance that they won't have it, but it's a lot rare. You'll hear over and over and over again the stories that patients will tell you is that I went to dermatologists. It was very expensive. And it was basically very, very difficult to sometimes afford the creams. Sometimes the people will say they just couldn't even go to the dermatologist or couldn't go to the medicine. And it's like, the consequences are there then afterwards. And they're living with this. And it's not their fault that they were in a poor socioeconomic status. It's all of our fault for not having universal basic income. That's what it is, actually. It's like all of our fault for not not setting that up for our people. And instead, it's like now these people are like suffering for decades and decades and decades afterwards. Ganesh is saying, doctor, can collagen supplements and tretinoin cream along with treatments give better results? Yes, it could. It could potentially help stimulate more collagen production. I don't know about collagen supplements. I would say that more of your diet, though. Start with your diet, and then if your diet's excellent, then yes, you could consider adding collagen supplements on top of it. But a lot of people don't even focus on the diet, though. That's what I was referring to earlier, that like sugar, dairy, these processed foods that we're eating. All that stuff is really just really, really important. Like just step away from all that stuff and drink like more water. Like don't drink any more alcohol. Stop smoking. Stop vaping, and you'll start seeing your skin improve that way. Like use more sunblock, that kind of thing, and that's how you're going to start seeing that difference there. So people focus on some of these supplements sometimes. Like some people, I have patients that have 120 supplements actually. And it's really like 120 supplements a day. I'm not saying they're not eating well, but like, man, it's like, that's really tough to do. I would say that's really tough to say, tough to achieve, like, whatever that's like an enormous amount. And there's a lot of people that will skip like the healthy lifestyle portion and just go towards the supplement world. I see it all day long on my feed, like all the time, someone's selling a supplement, and then there's doctors that just throw out these supplements all the time. And it's like, you could just, I just have a multivitamin. Just like, it's not that you can have supplements, but like try to be like healthy first. And then maybe if you need it, double check, see later on, but first do that part and work out. Why do people say it's unrealistic to see 80 to 90% improvement? Do you think that's true? I don't understand what the percentages are in general, to be honest with you. I really don't. That's my whole thing, is that I don't believe in percentages like at all. I think that every person's percentage is really subjective. Some people will look at something that looks really, really smooth to me, and they won't see that 90% or whatever improvement that someone else may see. And a lot of times we are our worst critics, and we're seeing our skin every single day, and we're looking at it every single day, and it's like really, really difficult to judge. And like I kind of like was looking at it too, and like, oh, maybe I got plateaued or so. And then like a year and a half, 2 years later, it's like, man, my skin does look a lot better right there. And just like you wake up and you realize that it does actually happen like that. And it's kind of cool. Like obviously it didn't happen like overnight. It was like over a long, long period. But like people get so hung up on like the day-to-day, like how it's looking and the percentages and what this is. I had somebody like they were taking photos every single day for weeks and weeks and weeks to see if there's a change. It's like, go and like relax and enjoy your life and touch grass, and then like come back again like 6 months, a year later, and then see what the result is. Because it's like day to day, and like you're stressed out about that. Like you can't see like if there's a result or not. It is like going to be like all consuming for you. And that's really where a lot of people have more body dysmorphia than people recognize. I mean, I think almost everybody has body dysmorphia, like some form of it, but like sometimes it just gets so overwhelming. It just gets like so, people just get so obsessive with it that it ends up really just going to a dark place for some people. Subcision filler or Subcision CO2 better as first step? Well, I really strongly believe in Subcision before I do the laser portion of things, for certain things though. But what I mean is that I really strongly believe in lifting up a lot of the scar tissue. But I also strongly believe in, like, for example, for this patient, I worked on the thicker parts of his scar with ablative CO2 laser there. I did that before I did the Subcision part there. So I did it all in a single step though. Oh, hi, hi, oh, where is it? Bao Kimmy, how's it going, Bao Kimmy? Hopefully you're doing well, by the way, too. So Bao Kimmy is asking, what do we do over here? So this patient, we did a few things. We did talar libitor subcision for this patient. We did a TCA Cross. We also did fat transfer for him, which actually worked out really well. The first photo is in May. The next photo is in October. Actually, I've seen him recently. He came back from a holiday recently, looking amazing, and it's even better. So it's definitely even like a year from now going to look even better. So it's like going to look even better and better for this patient. He's a really, really nice gentleman, really kind person actually, and it's like a pleasure to try to get him to like the best possible version of his skin. He's really trying to get like as smooth as possible, and that's like his goal, to try to get to something where it doesn't cause much damage to his skin, but still look really, really great and confident the way he views himself. He's otherwise a very, very good looking gentleman, and so it's like he just wants to feel better when he's looking at himself. He's just reminded of his acne and his scars, and so it's like we finally are getting to a place where he could feel a lot more comfortable about it. And he's like, finally I'm like going out and like other people are telling me that like it looks good and like it feels good for him. Which chemical peel is best for smoother skin that I could do on a monthly basis? I'm not sure why you would do it on a monthly basis. I like lasers, honestly. I like peels for some things, but like you could do like VI peels, the easy one that you could get access to. You could do that monthly if you want. But I really like lasers like every 6 months or so, like an erbium laser, really, really awesome. Thoughts on Halo? For scars, has anybody else here done Halo for scars? Sometimes people will say that they've done it, and they'll say the report that just wasn't helpful for them. That's what they'll say. What plan do you have for? Oops, so Margula. What plan do you have for this patient from his photos on the right side? So we did a little bit more TCA Cross, and there's still a little bit of volume loss that will end up solving a bit with some Bellafill. So I'm not really sure if this day I did it, but I ended up doing the last session. I did a little bit of Bellafill for him. Let's see here. Oh, my fiance is doing the VI peel at your office next week. Awesome, Joey. When's the wedding, by the way? So that's going to be getting ready there. Are my comments purposely being avoided? Where are your comments, Brittany? I'm not sure. Sometimes I see so many comments and so many different things. So I'm not actually trying to avoid comments, actually. I just there's so many. And then sometimes I see patients and I give people a shout out too. So just feel free to ask it again. I have post-inflammatory erythema. Can I still get acne scar treatments? Yes, you could. Sometimes it actually improves it a bit, actually, too. Sometimes if it's more superficial. July 11th, so maybe a couple of VI peels will help with that for the wedding time. Okay, so Smiley's saying, Smiley's been asking a lot of times, actually, so let's go to Smiley. Smiley's saying, to do things like you one day, would it be best to specialize in dermatology, or would IM also work? That's a good question. I mean, I don't know what the answer would be. I think that depends on each individual person. I think that some of it is kind of nice that if you're outside a bit, you could kind of think outside the box a bit for certain treatments, because sometimes it's just this groupthink that occurs when you're going around a certain process. I was actually thinking about this today, that like, why is it that certain things aren't taught or certain things aren't explained in residency over here? For I've worked with I've had dermatology residents rotate with me, dermatology fellows work with me, and it's like, why is it that certain things aren't taught that way? It really does become a lot of times groupthink. And like, if you notice, some people on here were asking about Phenol peel or Phenol Cross versus TCA Cross and TCA Cross widening it. It's like, these are stuff from like studies that were like 25 years ago or so. And it's like, maybe there was time for change, and people just kind of kept on doing this groupthink over and over and over again. So it helped me, really. I ended up doing this because I was looking at my face all the time, and I was trying to figure out, how would I solve this? How would I do this? And it was like, it didn't make sense what I was doing. What the way that the dermatologists were telling me to do things wasn't making sense. So I was like, there's got to be a better way. And I went to a consultation, and the guy was explaining to me that he's going to use the CO2 laser multiple times in order to raise the atrophic scar. And I did it, actually. I should say fractional laser, sorry. But I did the fractional laser multiple times, and it didn't raise my scar. And I'm not saying that I can't do it. I think there is some collagen production. It does help for that. But it was just like the wrong way of thinking about it. Why not? I don't know why people weren't thinking about that way. Why not soften up the edges of the scar with the laser and make that the new, make it into the new layer of skin? And yes, does it take a lot longer? Yes, it takes a lot longer for me to do it. It took me like I had 4 cases today. It took, everyone was very severe today, actually, or moderate to severe, most people. And so it's like, it took me a long time. I kept on tracing each of those individual thick scars and kept on smoothing it down. It takes a lot longer to do. You have to be very, very precise to do it. But clearly that was not taught. It's not taught. To this day, it's not taught. It's not taught by them. And they'll say there's too high risk, but well, there's a lot of things that are too high risk. It's just that you just have to have somebody focus on doing it and do it really, really carefully and train them to do it really carefully. When I was a med student, like it was like, people wonder, how do I have this work ethic? My first rotations were at Cook County Hospital. And I was like, just like, they were thrown. I was like thrown to this whole, this world where I had to run around at like 4 or 5 in the morning. And it turns out, people would say, well, like, we don't have any blood glucose levels today. And you're responsible for running around and getting all the blood glucose levels on all the floors all over the whole hospital. And you're doing that because by round time, you have to be super prepared and make sure everything's done properly. And like, it just has to be done. There's just no excuse. It just has to be done. Like, it's not like you're going to go tell your attending that, oh, the lab tech is not available, things like that. No, you just solve it. You go and like do it. And that's how I was trained. Like I literally was trained that way. Like I did it, and like I was like built in like that system, and it worked out really, really well. And then I worked over in like Thailand, and I did it like that over there too. Like I worked in a trauma center over there, and it was like, that's how I did it. I worked in burn units, and like, that's how we did it. So it's like, you're trained that way. So you could be trained to be very, very precise, but they just choose not to do it. Probably because the people training them don't have that kind of level of focus. They don't have that kind of time to be able to spend on working on each individual scar like that. It is very, very difficult to do that, actually. It's extremely difficult. And if you now have been bought by a private equity firm and you now have been forced to see from 30 patients to now 50 to 60 patients, it's pretty much impossible now for you to focus on a patient like the way you have to do, the level of detail that you have to do for a patient now to improve their scars. It's pretty much impossible now. So it's like, that's what the system became. It's impossible to manage their acne appropriately. It's impossible to do all those things. But how could you do it? Your private equity firm is now demanding that you see 50 to 60 people. And they're saying that you have to do procedures like mole removals and things like that. That's the stuff that pays for them. So, that's the problem with the whole system. And so it's like, I'm not sure which route to go. If you're really talking about dermatology versus anything else, it may be difficult to get to a certain point within the dermatology world unless you really do take a step aside and think to yourself that, listen, I'm going to do this a certain way and I'll be independent. The thing with me, I'll just say this one thing, is that I've never been a bootlicker. I'm never going to be like that kind of person. So it's like, I'm always going to just do things that I just think are just appropriate type of things. I'm never going to just sit there and just like bow to this type of stuff. So I'm looking at it like, you know what? This stuff doesn't just make much sense. So yeah, this is a lot of words. Jake is saying it's a lot of words. It is a lot of words. So it's like, I view this stuff as like, we have to actually just view it like, to change things, you have to actually take a step aside and don't trust a lot of times that this is like, that your attending is telling you to do it a certain way. Maybe they just don't have the time to do it the rest way. Maybe that's what happened. How do you do a consultation? You could do it directly on my page. You could do it at drqazi.com. Just schedule it just directly that way, and then you can actually just do a virtual consultation. If you're from further away, most of our patients are out of state, so you could just do a virtual consultation, and we could just do all that through like Zoom or so. And it's really, really easy actually. We'll circle your scars, show through all the different things that we have, and go through how I'm going to take care of that step by step. Would you recommend fractional CO2 or ablative CO2 for acne scars? So with this, I did ablative CO2 for the thicker parts of the scars and fractional CO2 for some of the other portions of scars, and then I did an erbium laser elsewhere, especially where you had a little bit of pigmentation. Brittany, sorry, I didn't realize that you were asking that many times. Sorry about that. So I'm glad I finally got back to you. So hopefully that answered your question, Brittany. I know you were asking a lot. You were wondering for a while there for that. Suggestions for ice pick scar revision for a patient with von Willebrand disease. It's not going to really change too much. You could definitely do, especially with like TCA Cross, it's going to be fine. You can still do pretty much anything. It's totally going to be fine. Allie's saying, I'm going to sign up for a consultation with you. Been to too many med spas here, and they only recommend laser. Yeah, laser is not going to solve most kind of scars. Faraz is saying, how's Faraz? How's it going? You're coming soon, I think. Is there a possibility that you're left with saggy skin after subcision procedure? So there is a risk with that. Yeah, I think that there's a risk, especially in the lower part of the face. It's possible. But these scars, cause sagging. You know, like my patient today, two of my patients today, they had lax skin, loose skin, due to their severe deep scars. That was causing sagging just by itself. And there's no question that it was it's causing sagging. It was loose. It was very clearly loose. The patients understood that as well. And the truth is that there's ways to do it very, very safely, very, very meticulously, very carefully in each individual scar. And we could do it that way. I'm never using blades or like a wild approach on the lower part of the face. That's where you could really run into that risk. There's also more of that risk, if you notice a lot of times, it's with people that put a lot of Sculptra or Radiesse the day that they do the lower part of the face. And that's when you could run into some problems because it could actually shift a bit there. So it's tough to say, really. There are some cases though. I've actually dealt with patients. I had to revise a couple patients who've gotten subcision done elsewhere, and the person is notorious. He always, he does it with these blades down the lower part of the face, and he's doing these moves over here where it's sometimes too deep or too superficial, and sometimes either one is actually potentially risky with these blades, and he has caused sagging. I mean, I've at least 5 or 6 of my patients now have been to him, or I should say they're patients now after they went to him. And, there's things that we have to do now. One of them really is going to have to be more of like a facelift. So there's a way to do it safely, and there's a lot of people that shouldn't be doing it, really. And that's why I would say that, like, you got to do it really, really carefully. And, it's like there's got to be like a way to, there's nobody out there that actually will claim that there's no risk with any kind of procedure. There's always some sort of risk. But the way that we can mitigate those risks is by really making sure that we're very, very focused every single time we're doing these procedures. We're very careful and meticulous as we're doing these type of procedures. And we have a really high safety profile. I do 3 to 4 cases every single day. And it's a very, very high safety profile. It's like just extremely safe. So it's like, sure, it's possible at some places, some practices where they do those type of things. Noel, how's it going, buddy? How have you been doing? Noel and I went to university together. Okay, saying, can I take low dose isotretinoin for life? Can I use tropical tretinoin while on it as well? You could do, low dose if you really want to, but there's more risk involved. So it's probably better just to do, transfer it over to a good, robust retinoid. I think that a lot of people kind of give up on the retinoids and say their skin is too irritated, but mix it with a moisturizer, take zinc, take omega-3s, start like really slow with it, and you'll see that it's like you could do that and you don't need to really be on an oral medication like isotretinoin. So, it's possible, instead of just like giving up on it, that you just didn't do the right regimen to get that acclimated for your skin. All right, guys, appreciate everybody. I will be back on Monday. I will double check to see. I will see if that patient I was talking about earlier today will let me share. I'm not sure, but I'll find out though, and we'll see if there's any more results for next week or so.